Hello everyone, and thank you for tuning back into the My Health, My Way podcast powered by
MYDAWA,
where we bring health conversations and information more accessible to you and in a
fun way.
You guys are cheesy, you guys. Forgive them. Forgive them.
I want to sing the entire thing actually.
And today I'm in the special chair because I am your host and special guest.
Yes, you are.
This episode where we'll be talking about sexual wellness. I am Dr. Samira and I'm here with
MYDAWA.
My name is Dushikuria. Welcome back, guys. It's just the three of us today.
By the way,
Yes.
so empty. Even our camera, behind the camera, people said,
Our
Actually,
we have
crews-
dumped you.
They said, actually, they told us, you're passing my interview. I hate you.
However, we still have an able team.
Yes, we do. Our
And
guys
Stivo-
behind the camera.
Stivo
And
and Eric.
Steve and Eric are
Shout
here
out
with
to
us.
them.
Yay.
So yeah, in case you didn't know, they're smiling, by the way.
They really are. Cheesily, actually.
And premolas.
So yeah, so again, we said sexual wellness. So let me just dive right into it and just ask my lovely co-host what sexual wellness means to them. I can start with Philly.
Sexual wellness means to me.
I think
Sexually.
I think we have to mute her.
Actually, all you're hearing is toot, 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 toot.
So sexual wellness, probably taking care of yourself when it comes to your sexual being, be it physically, taking precautionary measures, or just being careful and cautious, emotionally as well. So sexual wellness, yes.
She said daktari here.
Let me tell you, she said the medical term for it is I'm feeling well in my body.
And sexually.
And sexually. Sexually.
And we actually are all sexual beings, right?
Yes, we are. Yeah.
Do she?
I think so. I think, to me, it's a holistic sense of wellness. First of all, it's not sexuality. I think the wellness aspect of it is how you feel around your sexual self, whether it's within your body or it's with a partner. Just there being a wellness aspect to it, that you're making sure that the health part of it is okay, the relational part of it is okay, and you're feeling comfortable and safe around the topic
What a
of
dictionary.
Wow.
Okay.
I love that.
Yeah,
Because I
I
think
like
about the
that,
term
actually.
wellness for me in a more holistic sense is about feeling good. And in a whole sense. So when it comes to the sexual part, it's not only about myself, whether it's with a partner, whether it's with myself, in my body, or just feeling well all around.
I love it so
Is there a... What would you say, actually?
I think as a doctor, the first thing is always absence of disease, or like you make sure like you know, like you're healthy, like you don't have any ailments that are affecting you. Now that we are talking sexually,
Yeah.
and I like what Dushi has said, and in terms of like your emotional well-being and like surrounding yourself with people who protect you as well as love you is, I think, also key, because again, out here, the habits that we've started forming in these streets, you know, like
Streets are rough.
communicate about your sexual habits and your likes and dislikes, or like what you're doing.
Love that.
Yeah. And then if you know that you have something, or if you know like you have a condition, communicate with your partner. And I think like let's just be open, especially as women, to like partners or to like our closest friends about some of the difficulties we are facing. Because you could never know. And if not that, then with your gynae, with your doctor, just talk to her or him, and tell them, yo, you know, I've been feeling some slight discomfort recently, you know, when XYZ happens. And then you'd find out, kumbe squeezy, because of menopause and the estrogen dropping, you have a lot of dryness down there and all these things. And kumbe, if you just did a little, you know, tablets or a cream or something, it would help you and pick up conversations where we left off.
That's where we left it off, baby. Pick it back up. Let's keep going.
Yeah, so I think that's what it means to me, but I'm also very keen on the absence of ailments as a doctor.
And I love how you mentioned also likes and dislikes, because there's also the aspect of communicating the pleasure aspect of wellness. Like it's not supposed to be, I don't think sex is supposed to be painful. Sex is not supposed to be something you dread, right? You're not supposed to think about it with fear or you know, trepidation. It's supposed to be something that's
Trepidation.
Kingereza.
She said
Kingereza.
Trepidation.
Trepidation. Yeah, the likes and dislikes are such an important part of also communicating about your sexual self and having wellness in your sexuality or in your sexual being.
I actually like what you said when it comes to communicating. So say, even if you don't have a steady partner, communicating even if it's with your doctor or communicating with yourself. Because people nowadays have their own preferences. I mean, things are getting freaky out here. I may not know.
It's saying fetish without saying fetish without saying fetish. You know what I'm saying?
See me on the side. So yeah, especially that bit of communication. I
agree with you.
I think it actually does fall in wellness.
I agree with you fully.
Well, okay. So this brings us to our next point of wellness. As women, how do we make sure we take care of ourselves better? What are some of the things we do, some of the things we watch out for, especially during our menses, when we're not on our menses? Like, what are kind of our habits that we are
creating and fostering?
Oh, I think one thing may be discharge, I guess, which is, we all know probably what our normal discharge may look like or what we see. And if there's a slight change in that, then there's probably an issue.
True.
So actually, might you be able to expound more on what a weird kind of discharge could be, especially for me who is... I already know how my normal discharge looks like, but now I'm seeing a difference in color, a difference in consistency. What exactly can that be a telltale sign of?
Smell also.
Smell as well,
Your discharge smells different. Yeah,
Yes.
what is healthy and what is not healthy.
Exactly. What is healthy discharge? What is not healthy discharge?
Okay, that's a good question.
Yeah.
I have a chart. I can send you guys after this.
Oh, can we put it?
We can put the
insert
chart
here.
because it's so nice. It shows you from all the way when you start your periods to all the way when you're ovulating, pregnancy, blah blah blah. Like how you should monitor your discharges and how you should look. It's the same thing as how I would explain it, but I just like that it's in a chart. You know?
Yeah.
And like even for periods, it's not like the consistency is not the same, the color is not the same. It can go from bright red to all the way to darkish brown.
Yeah, like scarlet to
Come on,
kind
Scarlet.
of a burgundy.
Hey, Scarlet!
Scarlet's kind of like a burgundy. I was like, hey,
Mini
you said
failure class.
little red to big red.
Little Red Riding Hood. Okay, from a bright red to a dark red.
Yeah.
Actually, sometimes even pink, depending on which cycle of your period you're on. So if you have so your period should last around 28 to 21 to 35 days, right? Like not last, like the cycle.
I was like, hey, sweetie,
I was
it's giving anemic. What?
It's giving issues.
Hapo kuna shida.
I should
Hapo kuna
open
shida.
up to you guys.
Yeah, just tell us.
Tell us.
Tell us. We're here for you.
So between 21 and 35 days is good.
28 to 35, yeah?
21 to
21 to 35, yeah? The pool of 21 day cycles. Oh, wow. Okay.
So, and then now anything in between that, you know, monitor it. So is it like intermittent bleeding? Is there something that has changed recently in your life? Like you can always, as women, we can always tell, you know, like the bulb just lights up.
Yeah.
Like,
it's like, I know what it is.
So that's the first one. And then now after that, we have like clear to whitish discharge is normal. But whitish where it turns, I hate this saying.
Cottage cheese.
I hate saying that.
I love the cottage cheese reference.
Because
I love cottage.
I
I love
cheese.
cottage cheese.
I
But
love
I'm so comfortable saying it's a cottage cheese consistency.
I'm not gonna eat
the cameraman today are not having lunch. They're just like kuku ni kama hatungeacha na madem.
So anything between clear and whitish,
Right.
but not cottage cheese-like appearance should also be normal. And then again, if you're ovulating, most of the time you have a clear, slightly heavier, more stringy consistency. Even when you're having your pregnancy. When you're pregnant, you also have I think more clear discharge. I'm not speaking from experience.
Just from what you've heard and what you've seen as a doctor.
As a doctor,
Yeah. So clear white is all okay. Where we have problems is when it starts turning yellowish green. Sometimes even the yellow could be okay because it could be your diet. Ask those.
Really?
Yes, sometimes. If it doesn't have a bad
odor.
Yeah.
Okay.
So that's where we're going to go next. So if you have a bad smell accompanied with this discharge or any irritation, whether it's redness, whether it's itching, whether it's discomfort, whether you're having pain while peeing, all these are telltale signs that, oh, actually
something is going on here.
Yeah. So when you start experiencing a bad smell, the itching and the redness, then now you're worried and you're concerned. But there's still things you need to look out for. Like, for example, there are women who, when they take antibiotics, it can create an imbalance between their bacteria and yeast balance down there. And then now you have an overgrowth of yeast because that antibiotic said, I'm not choosing that throat you're treating.
Everything is going. Everything is getting out of here, man.
Fetus deleters to all
not fetus, just deleters.
I mean,
just
bacteria
deleters.
Bacteria deleters to everybody in this place.
Yeah. And then now, so a lot of the times as doctors, when we are treating our patients, when we're about to start you on very strong painkillers, we always have to ask, does this, do you get diarrhea when you're having, when you're using, yeah, it can cause also diarrhea. Do you get diarrhea most of the times, or do you get a fungal infection? And then we add you an antifungal as well, so that now you don't. Yeah.
Your body is more balanced out. That's okay.
And then now, when it starts getting yellowish green to gray, now you have there's a bacterial infection or there's something, and you need to see your doctor or talk to your doctor and explain your symptoms. They just do a test and then they confirm that it's a bacterial infection, whatever it is, and then treat it with antibiotics, the proper antibiotics.
So you've said antibiotics can trigger
fungal
or
overgrowth,
yeast overgrowth. So does that mean that people should take probiotics after the antibiotic intake?
Actually,
while
you're taking your antibiotics,
not after.
Take your probiotics as well.
Yeah.
Especially if you know, for example, for myself, I already have inflammatory bowel disease. So definitely that antibiotic is going to cause some discomfort in my tummy. So I always take with a probiotic.
Oh wow, I didn't know it was with. I always thought it was
after you're done.
Yeah. Oh my gosh, yeah.
Because I tend to get infections when I'm taking antibiotics. I just automatically just take your probiotics, sweetie. Yeah. It's okay. Yeah, you know what's coming.
Is yogurt a probiotic or is it a myth?
Your what?
Yogurt.
There have been, I want to give you a political answer. Minimal studies have shown
that there may or may not be.
May or may not be, you know. But from my patients, I have had patients who have come and told me when they take a specific type of yogurt, this is not an ad, but like kefir, you know, like that probiotic one, it's helped them. Yeah, so I think you need to just see what works for you, what doesn't work. Then just follow your healthcare provider's advice.
So I was also going to ask you about, so we're talking about female discharge a lot. What about men? Do men have normal to unhealthy? I don't call it abnormal, but let's say like a healthy to unhealthy discharge, or is just any discharge for a man other than ejaculation unhealthy?
So same as women, men also have various reasons why, as you mentioned, they have a discharge, and some are normal. And also for the man, the color consistency is clear to whitish. Then anything beyond that is also
an infection.
An infection.
Oh, food for I didn't know.
Neither did I, because I was like, I was just assuming nothing comes out of there until it's time for something to come out.
So for them,
what time is that usually?
Time nice, sweet time.
Guys, I don't even.
This episode is PG-18, and I'm telling all of you, this episode, if you're gonna watch it, beware.
I actually have no clue what these guys are talking about.
You've just arrived. I'm
just a girl.
Yeah. So I think so even for men, even for them, they have to watch out that it doesn't have a smell. Anytime there's a smell, it's alarming. Alarm bells should start.
And also, everyone should know by now, especially for women, because I'm a woman, you should know what your normal discharge smells like. Be aware of everything about your body. I feel like there's a lot of conversation going around because people are not aware. You're not aware of what your discharge is like. You're not aware of what your smell is like. You should even know, because I feel like there's a change in smell even during your period. You smell a bit different right before. Sometimes you can't even tell that it's coming. So it's important as a woman for you to be very know your
Aware.
body, sweetie. Before you want someone else to be knowing it, you
Know
need
it.
to know it yourself.
Yeah,
Yeah,
I
it's
agree.
very
It's part
important
of
for you.
wellness, in
Yes,
fact.
yeah, you have to know
Yeah.
everything about your body yourself.
Yeah.
Yeah, so now that we've talked about STIs, when we've mentioned severally, sorry,
Have we talked about STIs?
sorry, let's go back. Not that we have not mentioned. I wanted to mention something about yeast infections, right? I hear it's important for you to, when you're taking your medicine for a yeast infection, especially once you have one and you have a partner or partners that you're sleeping with without protection, it's important for them to take the medicine as well, the probiotic or the
Wait.
antifungal medicine.
Your sexual partner should
Yeah,
also
take the
take
antifungal.
the antifungal.
If you've had sex with your partner
Yeah.
and you had a yeast infection, it's important for them to take the medicine as well because you'll be paying paddleboard. You'll be paying paddleboard with that yeast infection. Yes, you're taking the dawa, he's giving it back to you. Giving it back to you. Giving it back to you. He or she. So it's important that your partner takes. Is that true, Doc?
So it's not just yeast infections, it's actually everything.
Aha.
If I have a UTI, my partner is getting treated. If I have an STI, my partner is getting treated. If I have a yeast infection, they are also
I didn't know
getting
that about UTIs, by the way.
It's
The
well,
whole-
it's all, yeah.
What?
Yeah.
Thank
Yeah.
God I have a doctor friend,
I will
guys.
tell you because
Here, I've been in
Yeah.
the darkness.
yeah,
What?
here
I
you
didn't
are.
know.
Here's the light. Here's the light.
Yeah. So what I've seen a lot of the times is when patients come in, they think a lot of men out there think yeast infections are only for women.
It's
Like
true.
only women get.
Yeah.
That's a myth. That's a very big myth because even they be getting.
Yeah.
In fact, maybe they're the ones transmitting in the first place.
True. They're the ones whatever in your
Destabilizing
destabilizing
your
pH.
pH
in the- to begin with.
actually.
Yeah.
Yes.
So men can also get, and that's why you just cover them. Same to the UTIs. You still cover your
didn't know about
the
yeast,
man.
man.
Yeah. And then still the STIs, of course, we'll get
Those
into
ones you
them,
have to-
but you have to treat both yourself and your partner or partners because we don't judge.
Yeah, we
Yeah.
don't judge here, sweetie. Do what you
Yeah.
gotta
Do
do. Just be
you,
safe
darling.
about it. All we're saying is
But
be
yeah.
safe while you're doing it.
Yeah.
Yeah.
Yeah. So I think we should get into the conversation.
Also, a fun fact is just because you haven't started having sexual relations does not mean
That's a very good
that
point.
you cannot contract a UTI or
A yeast
a
infection.
yeast infection, right?
Yes, and also don't judge. Yeah, because I feel like we're back in my day. There used to be judgment around getting yeast infections because you used to
Yeah.
assume that you must be having some kind of sexual.
Scandalous.
Yeah,
Yeah,
you're
it's-
like-
yeah,
and the thing is, I think,
scandalous.
by the time I got my first yeast infection, I wasn't sexually active.
Yes.
And I remember being so terrified and thinking, have I did I? Was it?
What?
Like, and the thing is, I was aware, but I was judging myself.
Exactly.
For even maybe when he looked at me, he gave it to me just from afar. Don't look
It's
at me like that
when
again.
I
As your uncle.
When I was
You know
in
what I'm
uni,
saying?
I was afraid of getting a HIV test. I was so scared, and I was not sexually active. And I was like, I can't do it. maybe that day, you know. Like, no, I can't. I don't think I can do it.
Actually, now that you've even talked about HIV, let's get into that conversation.
Yeah.
About STIs in general.
Yes, because HIV actually is under the category of STIs,
Is
right?
that sexually is that a disease? Is it an infection? Is it
Sexually transmitted infection.
and
But
diseases?
it's a virus.
So
Maybe you
HIV
can tell us more.
is not just sexually transmitted.
Yes.
There are other ways
Blood
you can
transfusion.
Right.
Yeah.
Alright.
But in the range, there's viral and there's bacterial. So there's the bacterial are our chlamydias, our gonorrheas, and
CFE.
Syphilis. Otherwise known as syphilis.
and then now for viral, we have all the way from genital herpes, herpes simplex 1 and 2, which we call. And then we also have HPV, is another virus that causes now, is notorious for causing cervical cancer. And then now we have also HIV. We have others, by the way, we have so many. It's just that these are the common ones that we see. And at least now, the myths are being debunked.
Yeah.
The stigma is slightly, it's going, like, you know, it's being, it's an everyday conversation now. Like the other day I had, when people were going to the safari rally, you had that story?
No.
Where it was between, I think the county had sent condoms, and then the guys were like, actually, stay with your condoms.
We got our own.
Prep. No.
Wow.
They're like, leteni prep na pep. Si tunataka tu pep and prep. don't want
I can't wait to get into this conversation for Prep and Pep
What
because
the heck?
the fact that we're normalizing it to me is such a,
tell you.
Yeah,
it's
it's
a
a
brand.
leap.
A whole
I
new
died.
world. Because I'm so proud of where we are as a country that now we are normalizing these conversations because there's a time Prep and Pep were thought to be for other.
What do you mean? Even HIV itself.
It was not a... Speak about it, sweetie. You know what I'm
Even
saying?
HIV.
So we are, but, oh my goodness, that's so amazing.
I
I'm
know.
so, I'm so,
Yeah.
like,
I
my
was
mind
like,
is
I hope
blown.
that story is true. I didn't watch like a news snippet, but they were talking about it in the office, and I said, wow.
What a wow.
But that's
Hilarious.
also a bit careless because you still need to protect yourself from these sexually transmitted infections. And the only way to actually do this is either through
Barrier
abstinence or
Barrier methods,
barrier
condoms.
methods
Yeah.
or condoms. Yeah, there's no other way actually.
Yeah, it's true. It's unfortunate, and you know, like for HIV, we were talking about HIV. So it's a viral infection transmitted through our bodily fluids.
Right.
So anything,
Blood,
blood.
semen.
So mostly blood, semen, and then it can also be transmitted from the mother to the child.
Yes.
And then also through like things like when you share like sharp objects, like like
Razors.
syringes, and all these things with someone who's infected and is not taking their meds. That's key, because someone who's taking their meds properly,
Your
their
viral
viral
load is low.
their viral load is it's actually undetectable. It should be undetectable.
Yeah.
And then see the virus is
Wow.
attacking your immune cells. So that's why that's why
You're always ill.
yeah, like you remember how the
Pneumonia.
stigma where if someone is just looking
Coughing.
thin,
Right.
Exactly.
That,
just-
yoni HIV.
Yoni.
Yoni
Exactly.
HIV.
Eh,
You're kind
Anaconda.
I'm a kind of AIDS.
Anaconda.
People actually say
Anaconda.
I'm kind of AIDS.
Eh.
You know, like
It was
what?
bad.
Yeah. And also one of the myths is that people used to say that. I remember people trying to debunk so much the myth that you can share a spoon with someone who has HIV, you won't get it because people were like,
Even a
oh,
chair.
a spoon? Oh, we're
Yeah.
sitting next to each other? Oh,
Yeah.
and now those have been debunked so much. Oh, if someone touches me and their sweat touches me?
Yeah.
No, guys, please.
Yeah.
Now we are in a place where you can get a lot more information.
Yeah.
Let's be more knowledgeable
My
and
health,
understanding.
my way.
My Health, My Way podcast, baby. Here, come here, sweetie. So yeah, I love the fact that now we're in a place for debunking. Now that you have also mentioned the fact that there's a difference between bacteria, infections caused by bacteria and those caused by viruses.
STIs, yeah.
Let's also talk about the difference with regards to
These
treatment.
STIs. Yeah. So let's talk about first STIs in general,
Yes.
because the key thing is for notorious infections like chlamydia, do you know it's asymptomatic? You don't
Oh, you
even
don't
know
know.
that you have it. You don't have symptoms.
You're just walking around here.
Look at your
My brain went, whoa, 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 whoa.
A lot of majority of the time it's asymptomatic, and for women, in fact, it can even cause infertility, because it tracks up and causes pelvic inflammatory disease, and then part of that is it causes scarring on your fallopian tubes, and then now the egg, or the sperm
Can't
cannot,
travel. Yeah.
or it can even cause ectopic pregnancies because now the fallopian tube has
It's closed. So you don't know. 9
So now
months
the-
you're feeling pain.
So now, the fertilization happens in the
Fallopian
ovary,
not in
in
your
the-
uterus.
Yes.
So
That is great. I didn't. So also, I know a lot of people haven't even gotten tested for a lot of people get tested these days for HIV because of the accessibility and conversations around even home tests.
Yep.
But the people I don't think who have ever tested for STIs.
which I think which brings me to my next step is if you're having like a long-term partner or like you have a steady sexual partner, I feel like the first step should be, especially if you're not going to have use condoms regularly, or you're having this, you're at that point in your conversation where this person or you both have agreed let's not use condoms,
for it.
then there's a basic sexual package that you can always do even at home. Literally, our lab partners can come. They do for you all the tests.
Really?
They do lab tests, blood tests for chlamydia, gonorrhea. They can do blood tests they can do
Swab.
Go up there and swab and do microscopic culture and sensitivity and just check, and then do all the viruses, HIV, syphilis, VDRL. Just do a basic.
Is this available?
You all exchange
on,
cards.
Is this available on
Yeah.
MYDAWA?
Yeah, you can call in and we will sort you out. So literally, Fini, if you're my sexual partner, this is what you're doing. Ndio hii hali yangu, leta yako. We see, aya, HIV negative. Nini, whatever, out.
Yeah. You're like, I'm not giving you this card, baby.
I mean,
let me read them out for you
And you
because
know
I'm not
what?
giving it to you.
In fact, that is
so you see,
good.
like
Transparency.
Yeah, so that by the time now you're getting into this relationship, you know you've both like tested for chlamydia, gonorrhea,
That's
and all
amazing.
this. Because again, maybe I had a one ka pimple or ka sore that went away.
Right.
And then because again, chlamydia is the symptoms are not there much. You can easily miss that infective period, and then now you just have it in your system, and now you're just
And the worst part
Pass
is
it
you
out.
pass it.
pass it to
And you so the test results remain positive up until the time you've taken the medicine
So
or
now,
whatever
and then
to
the
clear
medicine
it.
is for a short duration, literally, depending on how, like, whatever discussion you and your healthcare provider have, can go from 7 to 14 days.
That's
and then you're
bacterial.
done. For chlamydia and gonorrhea.
Oh, chlamydia
Yeah.
and gonorrhea.
Chlamydia and gonorrhea. So those are the two.
And they are the two most common ones.
Is it?
Common STIs, yeah.
Wasn't there a
But
time
then
there
for
was a
gonorrhea,
there was a what was it? Remember was it that outbreak of gonorrhea in the
I
country?
think it was chlamydia. Was it?
Was it?
No, it was
Okay,
gonorrhea.
It was gonorrhea. I remember,
It was
and there was
gonorrhea.
actually there was a
Yeah.
name for what was happening. You guys remember?
Super gono.
Super
Super
gono.
gonorrhea.
We had a
Yes.
super gono
We had a
phase.
super
Oh
gono.
my gosh!
Do you know what that
It was in the
though?
news.
The antibiotics that treat gonorrhea are still the antibiotics that we're misusing. They're kind of the same. So this strain is now resistant to those antibiotics.
You gotta be
So
kidding
it's become,
me!
now it's gone to the gym. This gonorrhea,
It's gone to the gym.
It's gone to the gym.
It has gained.
biceps,
Missouli.
it has
It's been having whey protein.
Gosh.
It has the nyash that you're looking for with those quotes.
It's not come to
Said, I'm
play,
back and I'm better.
baby.
And
I'm better.
Watch this space.
What are you talking
That's super
about?
gono for you.
You.
Yeah, it's like now with there's an increasing case of multi-drug resistant TB.
Oh my goodness.
Again, because of
Yeah, we've
Resistance.
normalized some and we've overused maybe,
Yeah.
and yeah.
Yeah.
That's really
So in
interesting.
the same breath, you were speaking about the bacterial. So can we touch on the viral, especially when it comes to HIV and HPV?
Yeah.
Because there's a HPV awareness and discussion that's been going around, and I think it's been happening for a few years now.
Yeah.
And there's a few myths and misconceptions as well around the same topic.
yeah.
First myth, let's start with HPV. Can it be contracted by men as well?
Yes. And it starts the moment you start sexual activity, you're already putting yourself at risk of contracting this HPV. And that's why in a lot of countries, not Kenya, in school, like you actually get the vaccination while you're in school before you even get
No
delivered. Yes,
way.
it's
Because that's
been
when it's meant
normalized.
to be
A
given.
friend of mine
in fact.
told me in Ireland they get the HPV vaccine.
So it's
And
like this one we were
normalized,
getting
part
here,
of
the
their
one that we all
curriculum.
have
Then you
the.
know some GHC.
I don't want to be here no more.
Yeah.
I want to be in what is it? Ireland, Denmark. I want to go. I want to go there.
So it's just like this normal one that all Kenyans get. It's called BCG.
ABCD, EFG,
For your
baby.
TB.
For the Nice.
And I have no idea.
So,
Free.
yeah, so you can be
That's
vaccinated, and the age is
amazing.
between, I think, for adolescent years, like between 9 and 12 years.
Yeah.
But you can get it anytime up to the age of 26. But because you're above it or because you're now sexually active does not mean that you're no longer eligible for the vaccine. You just need to talk to your healthcare provider.
That is actually another myth, because I thought that you can only get the vaccine for as long as you're not sexually active. Oh, I got
yeah.
it.
You did?
No, good
Well
job.
done.
Oh.
Oh, okay.
See, I was doing
She did first. This, but I didn't see. I think you're making.
You'll
I
catch
thought she was
it.
twitching.
Cut.
You'll catch it.
Mtakata
Yeah,
tu.
so
Mtakata. Mtakata yo.
I thought you could not get the vaccine if you're already sexually active.
Yeah.
So that's not true.
It's not true, but it's also tailored to every individual.
Right.
So I
Right.
think now the thing that is as standard for all would be both you and
your
a
partner.
man can get the vaccine, especially if you're not sexually
I
active.
thought it was women.
So you can even get
everyone.
you can get it for your sons.
Imagine
That's the thing. I
that
think
now,
yeah,
when
communicate
they're 9.
to your parents.
take
Yeah,
them, just
because the thing is, at one point, whether maybe unless they want to become a priest and
Mormons.
or want to leave a
Mormons
nini.
actually, no.
Yeah, they still Mormons actually they are polygamous even.
Yeah, sorry.
Yeah, so unless you are the person chooses to not or have an abstinent lifestyle, and that's a choice that they will make when they're older, it's important to just, if you can, protect your kids. And it's one less thing in the world that they would have to worry about as they grow older.
I love that.
It's not that you're sexualizing your child, it's that you're trying to protect them. And I think that needs to be the thought that is communicated through.
I love that.
It's about protecting them.
Yeah.
That's really, because I think...
And you know what? There's over 100 strains of this HPV. So even the vaccine is protecting you from like the ones that are most susceptible to causing cancer, which is the cervical cancer that we're talking about. Which is 16 and 18.
Did you say 100 strands?
Over 100.
I'm still there, by the way, as well. Yeah.
Over 100, if I remember correctly. Okay.
So when is this vaccine most the word was there.
Effective?
Effective?
Yeah, when is this
Before
vaccine
any
most
sexual
effective?
activity.
That's
So
most effective.
Because you're not yet exposed to all these HPV strains that are out here. All the 100.
All of the 100.
Over.
So
all of the 100.
Say Dushi is sexually active.
Me?
What?
What would make you think that?
The halal dushi.
I'm halal. Oh my God.
Say Dushi is sexually active.
At the ripe age of 35.
Say you are. You know, I'm not.
We're talking about me here, sweetie. It's okay.
Call her. So, say Dushi is sexually active.
Yeah.
Is the vaccine tailored according to her specific requirements, which maybe could be age, etc., or how do they determine what vaccine Dushi can get in comparison to me?
You see how the same way like a flu vaccine would work. It's just so it's not tailored to you, but it's preventing those specific types of the HPV strains. So it's not actually because now I am 25, I have XYZ, so I'm getting vaccine Z.
Vaccine Samira.
You know, vaccine Samira.
Right,
no.
yeah.
It's the same way we all got a COVID vaccine.
Okay.
And it's just, so
Across the board.
standard across the board.
That's
it's protecting you against the most notorious strains.
That
just
can
have to
cause
talk to
cervical cancer.
I would just need to talk to my gyna.
Yeah. Because like 11 and 12 also cause. Yeah.
Right.
Yeah.
Okay.
So that's HPV.
That's HPV.
And then now.
Even herpes. I'd like us to talk about herpes as well.
Hey, we can do
notorious.
herpes.
Because herpes and HIV do not have vaccines, for one. Or cures, right? And it's important for people to know, first of all, there's no stigma around it. These are even communities. I've seen communities on Twitter for people who have herpes. Just to be able to give them, like a pages where it's about community, and they give people like access to resources to be able to find community of people in your area if you have herpes, understanding when you are, I think it's active or dormant or something like that. So when you're susceptible to spreading it.
I know.
I guess this is my episode, sweetie. I've taken the quote from you. I've taken the quote. Yeah, so these days, and even with HIV, as you mentioned earlier, when you're taking your meds, your viral load is low. So people don't think about like a death sentence anymore. There are communities where you can have people around you to support you. Especially in South Africa, they have a very active community of people who support each other.
The percentage is high.
The percentage is high, yeah. So people who have been born with HIV or have contracted it in their lives create communities where they can have a space where they feel safe to be able to talk to other people who share their same struggles.
Yeah.
On the same note, isn't HPV also incurable as well?
Yeah.
If I'm not wrong.
So it has no cure, but the notorious ones can go on and I keep calling 16 and 18 notorious. You know, the ones that are susceptible to causing cancer can go ahead and cause like genital warts or cancer if the body doesn't naturally clear it.
Eject.
So,
Okay.
Yeah, she said
Eject. Get out of here, man.
Get out of here.
Right.
Wow.
Okay.
Yeah. And I think we hadn't touched on HIV yet.
No.
So we had said HPV and HIV.
And with HIV,
so
we can also discuss
HIV.
PrEP and PEP.
Yes, because even I need to.
That's a bigger conversation to even discuss. And also on the MYDAWA, you cannot plug in.
Exactly.
Come on, sweetie.
There we go.
So, do we talk about herpes first?
Oh yeah, let's talking
Yeah.
about herpes.
So-
I forgot we were talking about herpes.
Yeah.
Yeah.
Tell us a bit about herpes.
Herpes.
What have you? I want to hear. What have you guys heard about herpes?
Nimbaya.
Hiyo kitu ni mbaya.
bad.
Hiyo kitu.
It's real
hiyo
bad,
kitu ni
Michael
dangerous
Jackson.
na haiendagi.
Ni uchungu.
Yeah, hiyo ni kitu mbaya.
It's
Also,
bad.
the gift that keeps on giving because it doesn't go away. That's a tagline we used to use in our generation.
Here?
It's the gift that keeps on giving because it doesn't go away. And then you can give it to other people. I also know that it ranges everywhere from mouth sores to genital warts.
She said daktari.
Let me tell you, at the age of 35, I did know these things about sexual wellness. I would be doing very badly for myself.
Actually, you're right.
Yeah.
Yeah, so
Yeah.
ranges anywhere between mouth sores to genital warts.
Yeah.
I also know that there is the whole active and dormant conversation that I remember seeing on this TikTok page. That's so far what I know.
For me, I just know it's real bad. Michael Jackson.
Real bad, real bad.
real
Michael
bad.
Jackson. It's a bad one. Yani,
Yeah.
he only bad one.
She said
bad
Michael
man.
Jackson.
So, enlighten us, by
Please,
the way.
she's said everything. So there's HSV1, herpes simplex virus 1, and herpes simplex virus 2. 1 is the one that causes cold sores, 2 is the one that causes genital herpes. And again, the person is most infectious when they're in their active phase, which is when they're having these sores. And then these sores, if they're open and you're having physical contact with your partner, whoever it is, then you can easily spread through direct, like,
So saliva.
anything.
Damn.
Right,
God
right.
damn it.
And that is the biggest risk, and that's why they need to know if they are in active phase or remission.
Oh, it's called remission.
Yeah. Because
Aha.
there'll always be flare-ups.
So, okay.
And I think the biggest thing for the herpes community, as you said, there's a community,
Yeah.
is open communication. Again, open communication. If you tell this person that you're having this physical intimate connection with,
Yeah.
that you have this genital herpes, you're now in remission, but you can use barrier methods, you can use condoms, then it should be smooth
Actually,
sailing.
that's also consent.
Yes.
Yeah.
Because
Yes.
then not
Because
informing
even,
somebody.
Yeah, because even
Yeah.
you who has it, I'm sure you didn't get it just by chilling.
Right.
Someone said, I'm not going to give you information. And now
Yes.
Very
I've
true.
literally just made you live a very painful life. Because now when you're having the sores, they're so painful. By the way.
They are?
They're very painful.
Oh,
So they are put on a range of antivirals so that you can bring down the
viral load.
the viral load, and then they get into remission. And they can even stay, by the way, for a long while. It's just, again, when your immunity goes down, it can flare up.
Right.
So it's unfortunate.
So it's naughty in a way. So it can decide when to come back. and
Yeah.
when-
You said it's
okay.
naughty.
Yeah, naughty,
Really
back
naughty,
to bed.
naughty.
Yeah, so again, and then, this is again something, there's no cure. So by the time you're infecting this person,
Yes.
you're not a nice human being.
Yeah.
And as with any STD, I feel like
By the
if you
way-
know that you have STI even,
Yeah.
if you know that your discharge has changed and you might have an infection, maybe you haven't had time to go to get checked or go to a clinic, don't then go to the middle of the
enjoy
club
it.
and get somebody and then take them home and then give it to them. Like, I'm
They
just,
were
I'm
just-
just
they were
like,
just
yeah, I think it's really important to be conscious
Yeah.
of yourself and then also conscious of other people,
Yeah.
right? You can just
Even your
hold those
partner.
Be
nyeges,
human.
go home
Yeah.
and sleep and go to clinic
DJ
or
or
call my
something.
dawa to come over
Go
and
and
give.
DJ.
Actually, the fact that my dawa can come to your home and test,
Yeah.
that has blown my mind.
Yeah. So
Yeah.
we have partners, not MYDAWA ourselves. So we have partners
But through
who
like
MYDAWA.
come,
Medi-
yeah, Metropolis, the one who did
Yeah, Metropolis.
our sugars. So
Yeah.
Metropolis, Lancet, we have Elara Health. So all these partners can just come and do it at the comfort of your
It's beautiful.
house. Yeah.
Love it.
I love
And even
that.
for the HIV.
Let's get into it actually.
Actually, yeah, let's dive
Just
into it.
However,
just
ju-
jumping,
right before,
jumping.
I have a question as a layman about hepatitis.
Aha.
Right? I hear,
Okay.
correct me if I'm wrong, that
Yeah.
hepatitis can be sexually transmitted.
Okay.
I'm not sure.
So there's different types of hepatitis. Hep A all the way to, I think there was an E. Hep A to D to N E. Some of them are, I don't like saying these words, but when it's stomach, it's normal. But there's some that are fecal oral. So it
Fecal
can-
oral?
Yeah, so it's passed through like unhygienic means. So because
Ah,
you've touched.
rim jobs. Sorry. To cut that out.
Whoa, please, Mr. Director.
You're gonna have to cut
delete
that out. But to be very honest, that's the
Bleep
first
her.
thing that came to mind.
Bleep-
So,
No, I same. I was just.
So like,
just lingers in
like,
the
you know
in
how
the other
even,
lingers.
like when you have like a
But it's in that part of like. Why is that bad manners?
The other lingers.
Cunnilingus.
The other lingers.
The other lingers.
The other lingers.
It's cunning. It's bad.
No, but I'm just saying that's
no,
why.
no.
This whole this has to
You're gonna cut it all out. Cut it. Cut it. Actually,
guys.
this could be the reel for Instagram that just goes tee 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 tee
Yeah.
tee 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 tee. Yeah. Okay. So the other.
So,
So fecal to oral.
yeah, so
Oh,
contaminated
okay.
food or water or like you know.
That's what you meant,
Yeah, like
sweetie. You should have started with that. You should have started
You were
because
gone.
I was away. I was in Denmark. I traveled. I took a flight and
I was
gone.
where they give free medical attention, sister. Hey?
Right. So okay. It's,
and then now there's Hep B that can be spread through blood. And that's why even when you're donating, they
they
always
check for Hep B. Okay.
Yeah.
Okay.
Interesting. All right.
And
I didn't even know
So
there were
it's
all
sexual.
there were all those heps. I actually thought I think the only ones I've heard of are
A
there's
and
Hep
B.
A, B,
Maybe
C,
D?
and E.
Yeah.
I don't even know where I've heard
Actually,
of D. I'm
only
not too
has
sure.
A, B, and D.
Yeah, I didn't know.
Yeah.
So is
Okay.
it sexual?
Sexual.
Sexual.
Maybe
It's not
through
sexually.
blood. I don't know. No.
Okay. Perfect.
Okay.
Thank you, Dr.
Thanks, Doc.
HIV.
Yeah. But they're all like, you know, like hepatitis is like affecting the liver. I should have started with that.
What are you talking about?
It's an it affects the
The
liver. It's a
liver,
viral
right?
infection.
Yes. Okay. Yeah.
That
yeah,
affects
affects
the
the liver.
liver.
Right.
Yeah,
Right.
so it's not
So
an
like
STI.
cirrhosis. Okay.
It's not an STI.
Okay.
Yeah.
Okay.
Right. Yeah. Just like cirrhosis,
Hey.
but without the alcohol part.
Tequila.
Yeah. Right.
Anyway.
So
Okay.
yes, you mentioned HIV, and I feel like this is a perfect
Yeah.
segue for us to
I
jump
agree.
into
Yeah.
the larger conversation about
HIV.
Yeah.
HIV, PrEP, PEP, protection, viral loads.
Abstinence.
And that's
I
something
swear,
people.
Finny has insisted on this.
She said, let's tell the people
the
also. You
abstinence.
can abstain.
Abstain.
You
Watch
can.
it. You
Yeah.
can
It's all
abstain.
right. It's all right.
And it's
Yeah.
good. And it's okay.
Yes. That's true, sweetie. No war. That's it. Okay. But for those who are not abstaining,
Yes.
right?
Yes.
What
For
do
those
we
who are
need
here
to
for a
know?
good time.
And not
Not
a
a
And
long
not a long
time.
time.
and
But
a
also a long time.
And also a long
You want to
time.
be here for a good time
to
and a long
continue
time.
having a good time.
Have a good time for a longer time.
I agree.
Yeah.
So HIV prevention is one of the key things that we are interested in at MYDAWA, especially for the past 2 years. We were doing a study with the Bill and Melinda Gates Foundation where it's not the standard of care by the to get PEP and PrEP through an online pharmacy.
Is it?
Yep, you had to get an IRB protocol, like you have to get a study protocol where every person who has gotten PEP and PrEP through the online pharmacy has to consent that they understand. Ideally, in Kenya, you have to walk to a CCC, get your pre-test counseling, do your test, get your post-test counseling, get your PEP
Results.
ARVs
Yes.
or PrEP. So now we tweak the journey where you do the test, you take a photo. So it's a HIV self-test. You do the test for yourself.
Actually,
There's
what is PrEP and PEP?
Good. Cool.
Thank you.
PrEP is pre-exposure
Prophylaxis.
prophylaxis.
Is it?
Actually, prepare for PrEP. Yeah, actually. Yeah. So PrEP. Our tagline was, what was our tagline? G-PrEP na MYDAWA. G-PrEP mapema
Mapema ndio best.
Yeah.
I like that. Yeah.
That was when mapema ndio best was
China.
Aha, yeah.
And so PrEP is pre-exposure prophylaxis, and this is a daily pill that you take. We like to say like brushing your teeth, but brushing your teeth is not a daily pill that you're taking.
Right.
Ideally,
Or your supplements.
Your supplements, actually. Yeah. So you take it every day, and this is to protect yourself, your loved one, whoever it is that you're trying to protect, and also so that you can prevent from getting the infection. And it starts, and you have to take it for a maximum of 7 days, so that there's enough of it in the system build up, so that you can now start,
Actively doing the thing.
actively
Yeah.
loving. And then, bleep that out. But still, this has ensured that you've prevented yourself from HIV. Remember, we've talked about all these other STIs. So ideally, if you have multiple partners, or if your partner has multiple partners, because we don't judge, Then you protect yourself from. You're like Z.
How can you not have multiple partners and then your partner has multiple partners?
Because maybe you're not in a
we need to talk about
relationship
this,
with your
sweetie?
partner.
Okay.
Let's talk about it.
Do we need to talk
yeah,
about
because
this?
it's possible to be with a, they're your partner for
guess
now.
it's-
Not my partner for like life.
No.
Yeah.
But when you say, I don't have multiple partners, but my partner can, why can't I?
But they're not my partner. Can't I?
Yeah.
Can do whatever they want.
I
think it's just that
I get
understanding that, for example, if Dushi wants to just have sex with one partner, but we're not in a relationship,
Yeah.
I just know I don't have the capacity to just be
Yeah.
dishing this thing out
Yeah,
here like
yeah.
it's,
Yeah.
I do want to say the thing I wanted to say.
Yeah.
Just dishing it out here like crisps, right? Like tequila shots, yeah, or crisps, right? But I'm not in a relationship with this person, so I'm not telling this, and we're not exclusive with each other either.
Exactly. Thank
So
you.
this person is out here also dishing it out, but then they're dishing, like they're out here just pationing like this, yeah. So I'm
Flyer,
like,
that's
sweetie,
people's daily newspaper.
yeah, or the gutter person, they usually patiana on the street.
Maybe I'm so distracted. This light is making your hair so glorious.
Does it look?
Yeah. And
Is
you know, I
it?
think it's a reflection from her clothes.
Yeah, all
To
the
the
way
It's
light.
also
light,
going to the light, to the hair.
Kanakwamba. Thank you, sweetie. I can't wait for a photo of this.
distracted.
I can't wait for a
swear.
photo.
Sorry.
So,
Yeah, it's important for
So you were speaking on
Yeah,
the
so-
prep and pep.
Yeah, so I'm still on PrEP prep.
Yeah, prep.
the before.
Again, I have a partner who is HIV positive, who's taking ARVs. Their viral load is like low, like non-existent, undetectable, and we're trying now to have a baby. So now I am now on PrEP because we want to protect this child.
PrEP.
PrEP, yeah.
Not prep.
Yeah. So I'm protecting myself from getting the virus as well as
Oh, because you
my
won't be
child.
using protection to try to
Of
conceive
course.
a child.
Yes.
I understand now. Yeah.
So those
Like,
are
I was like, yeah.
No shit.
Insert light bulb.
Yeah.
Actually, no tea.
No
So,
Okay.
Yeah, so
Actually
again,
interesting.
this is called discordant couples.
Yes.
So where one is positive and another one is negative.
negative.
And by the way, we have so many of those. Yeah, so many of those couples, which are kudos. I love it.
Yeah, because you're being open, there's open
yeah.
communication and there's
Yeah.
understanding.
And it doesn't
Respect.
change the love that you have for
Exactly.
each other.
And it's respectful even.
Yeah.
Yeah.
So that's prep, and then you just continue until now you're no longer active, sexually active.
Okay, you take it through the sexual activity.
Yes.
Okay.
Yeah.
Okay.
And then now there's PEP, post-exposure prophylaxis, and just as it says, it's after an exposure, but then there's a tight window of 72 hours. So within those 72 hours, you have to take, like just like
Oh,
P2.
so is this like in a case
Actually,
of
just like
assault,
post-natal.
sexual assault, where
Yes.
you're not very sure?
Yes.
Okay.
Yes.
So in all those cases, as long as you make sure within that 72-hour period you have done your test, confirmed you're negative, and you have started your meds,
Okay.
you're good.
Okay.
Then for PrEP, by the way, there's like a eligibility. You have to make sure you have a healthy liver, healthy heart, healthy kidney. Like they have to do those basic tests.
Is it?
Yeah.
Okay, because it's
again, this drugs. A lot of times, if you've seen doctors who have pricked themselves, maybe when they're doing their surgeries,
Yes,
and they're
yes.
now on the PEP,
Yeah.
you see a lot of times they're having such bad symptoms. They're having diarrhea, they're having yellow eyes, because again, it's being metabolized in the liver, so it
the
can
liver.
burden your liver.
Oh,
so
and
you
it's
have
a, it's a powerful
Adjunct.
drug because it's trying to.
protect you.
That's
So,
interesting.
yeah, so you have to do those
Okay.
baseline tests for PrEP, and then for PEP, because it's just 28 days, you can take for the 28 days, and then you repeat a test. That's important.
Important to
Repeat
take
a test,
after.
confirm you're negative. In fact, for that one, we don't do the HIV self-test. You can even do the confirmatory one, where you do a determined test or
What's
a
that?
rapid. So there are different types of testing.
I was
for
actually going to
HIV.
ask you about the
The
different tests
different
and the
types.
window periods for those
Yeah.
tests as well.
So there's the HIV self-test,
Uh-huh.
where there are so many, by the way, in the
You
market
do at
now.
home,
You can
yeah.
just do at home. You do it. You have instructions, and then for yourself, you can even interpret with the CNT lines or whatever.
I've
Just
used
like a
those.
So it's
pregnancy.
like
I've tried them
HCG
before.
test.
You've tried
I've
them.
tried them before. I
Yeah.
love them.
So
Yeah.
do you?
They're
Is
great.
it an injection?
You just prick your
No,
finger.
you prick. You literally prick your finger. Yeah, I wish I even
And the
brought them.
instructions, yeah, actually, I wish
Yeah.
we
I brought
brought
for
them.
this channel.
And
Can
they're
do
so,
tomorrow.
Episode.
the instructions are so clear. They put their pictorials for you to be able to understand
They even videos.
how to. It's really fantastic. Actually, it's even something you could do with friends.
Yeah.
Oh yeah.
Yeah,
That would
just
be a
like have an
nice,
evening in
game
the
night
yeah.
idea.
Yeah. So there's that, and then there's now the testing in the lab, like
Hospital.
like you know how
A
you
blood sample.
you do a blood sample and then it's tested for HIV 1 and 2 antibodies, or it's tested for PCR, or it's tested for like there are many tests.
What does that mean? So antibodies is a
So-
different test than PCR.
Yeah, so you can do HIV 1 and 2, which is the rapid one. So you're
Okay.
testing for antibodies.
Okay.
Or you can do the way, you remember how COVID, there was the rapid and then there was the COVID, like the PCR
Right.
Yeah,
testing.
the one you,
Right.
yeah.
So there's a PCR testing also for HIV.
And does the difference
So
in
that
those
one
tests?
looks at the viral load. So if you have any viral infections already, like in
Are
the
there
blood.
different window periods for this? Like, is the home test different from the antibody test from the PCR test, or are they all pretty
They're
much the
all
same?
different in terms of like for the self test, if you do it and you get a positive, you can still go and do a blood based test to confirm.
Okay,
Like it's not 100%
Got you.
Accurate.
accurate.
got you.
But if you do the blood test and you do a positive, then now you can go ahead and do other form of confirmatory test, but the blood test is confirmatory.
Okay.
Yeah, so
Got you.
that's the only difference. Like
Okay.
if I got a positive with a self-test, I'll tell you not to panic yet until you do the blood-based
Confirmatory
one,
one,
and then
yeah.
now we can now start
Have a
However,
conversation about
conversing
moving
about
forward.
In primary school, because I think this is when we learnt about HIV, so I've gone a bit back. We were told that there's a window period where you might test for HIV, say you're having a wild night escapade, and you have these self-tests at home where, let's say you've come back with somebody, and you decide to do the test, and it turns out negative.
Right.
Yeah.
There was a window period when we learnt in school that the load
The
might not be
incubation
there,
period.
incubation.
That's
However,
the
this
word,
person is infected
Yeah.
and engaging in sexual
Risky
activity
behavior.
or risky behavior, risky,
True.
can actually
This guy.
infect you.
Yeah.
Right.
Is that true?
Yeah, and you can if you're very like if you think yeah this guy's sus, you can do the test in 1 month and then you can repeat again after another after 3 months. Like 3
Exactly.
months
3
after
months
the-
was
So
the window
90
period.
days is the that's what I was calling the window
Yeah.
period, incubation period.
Yeah.
And
And
it applies across the board. So whether it's the PCR, 90 days later, you still need to do it. You said antibody,
HIV 1 and 2 antibodies.
1 and 2, and then even the home test. It's still do it again
Yeah.
in 3 months.
But what I would suggest is if you have any shadow of doubt, just take the pep.
Strap up.
By the way,
Oh.
it works. It is 99% effective.
Wow.
And and you are now after the month, now you're going to do the test. You'll have you'll have known you tried everything like
in your
power
Right.
to prevent yourself from
Right.
getting this virus. So that after that you won't blame yourself. You won't be like, "Kai, aki ningechukua tu."
Yeah.
You put all the measures in
Right,
place,
yeah.
and then but if it happened, it's fine. But if you could protect yourself, why not? There's
But is
all this
PEP something I
technology.
can just buy over the counter?
No.
Yeah.
Yeah, you can't. Again, it's a very strong drug. It's 3 molecules in one pill. That one pill, by the way, it's 3 different molecules that are acting in the different mechanisms of how the virus infects the body.
Got you.
Yeah, so by the time you're getting it, you have to be sure that you didn't have even if you use the barrier method, then there was either contact with the bodily fluids. This person has not had an HIV test within the past 3 months, or yourself. You didn't have the initial signs of HIV by there are like flu-like symptoms, runny nose, and flu.
Why did you just sniffle, both of you?
Are you feeling HIV?
She said runny nose everyone else.
Fever and all these things. So
Right.
if you knew you had an exposure a month ago and within the past 30 days you're having the symptoms, then now you have to be like, okay, let me do my test.
Right.
So like they're always like when you're talking to your healthcare provider, I believe in giving them 100% of the knowledge, as we spoke with Dushi.
Right, be
Just give them
open.
everything so that they can give you the best advice on how to go about your particular situation.
Yeah.
And we even have people who have called us and they're like, I was in an accident and you know how something can injure you and someone else at the same time.
Yeah.
And they're like, I need to protect myself. I've already gotten my tetanus shot. Do I take my PEP? And I
Yeah.
like when they call
I
in and
like
ask
that,
because
yeah.
at that moment, then we can advise you, was there any contact with that person's body
Blood,
fluids,
yeah.
You don't even realize, even in an accident,
Yeah.
you can get exposed to HIV.
It's so
Yes.
true. It's very true.
Yeah.
That is
Yeah.
so nice.
I love
Not
the fact-
nice. That is
It's so informative.
Informative.
Yeah, and that's
So-
it's nice in how informative it is.
Yeah, so you can get PEP and PrEP through MYDAWA. You can just book a consultation and you can speak to any of our doctors and they'll be able to assist you with, even if it's just inquiries, by the way, just call and just ask about this pep and prep.
I've also liked that you said MYDAWA offers the testing for partners or whatever, even yourself, for sexually transmitted infections, diseases, and HIV is inclusive. I think we can do something like that. Maybe even just do HIV tests and
and show people even the how to do the home test. I'd be very open to doing that. Yeah.
And there was this slogan back in the day, Nimechill.
How back in the day? Have you heard?
Do you remember Nimechill?
You know how old I was when Nimechill was going on? Guys. But yeah, Nimechill used to be like this. But I always used to say, probably we should chill like this. And not like this, but that's none of my business. That's none of my business.
People used to say that.
I was like, you can't. I'm not chilling like this, sweetie. Nico,
I need to chill like this.
Chill like this. Yeah, but anyway, I remember Nico chill.
But that I think was so nice.
I think it's important to talk
very
about.
Nice and informative.
Yeah.
And also they used to advertise.
Yeah, it was.
And they also used to advertise condoms a lot. I don't see many condom advertisements anymore on TV. I remember even Trust used to have these really cool adverts. It was raining. And I remember when I was a kid.
The umbrella
and it
thing.
says
Exactly.
And it was J Unayako.
I have never cringed. So my cringe was cringing.
And guys, I even asked my parents, imagine you can read this. But I asked my parents, I don't have.
Even I have.
You wanted a condom?
J Unayako. So see, I'm hearing
you were like, so what does I have?
They're asking us if you have. Me, I'm like,
oh, sweetie.
I don't have.
I want to.
Dad, why don't I have?
He's looking at you thinking,
and but then he was not even looking at me. He was just like,
wow.
I'm going to ignore her until she stops. Yeah. But I think it's also important to add the fact that, and Finny has been mentioning this severally, that also abstinence and even celibacy is an option. If you're going through a season in life, even after you've had, there's so many, the people used to say, and I don't know if they still say it, that you can have tertiary virginity. If you wake up today at the ripe age of 34, 35, and you say, you know what, I want to start again. I know people say medically that the hymen maybe is like, or not necessarily the hymen, because I know you can break your hymen in many different ways. I know you can even fix it. You can get your hymen redone. It just does, and then it's just like, whoa.
You can fix a
barrier.
They
have created the hymen out of this guy.
Guys,
so
I have a new hymen.
You can choose to restart your journey with your celibacy. If you feel like you're single and you don't want to be you don't have different partners, you want to be in a relationship and have whether it's monogamous or it's exclusive in any sense, you can.
Or you just want to funga duka.
Or you want to funga duka. Funga you kitu. Who's stopping you, sweetie? No one's gonna tell you what to do. It's your body. It's your choice. And actually, speaking about before we conclude, because we are a few minutes about to conclude, I want to talk about things that we have maybe not spoken about so far. Things like consent. Things like pleasure, because these are parts of sexual wellness. Sex is supposed to feel good. Things like vaginismus, which is where your vagina closes up or penetration becomes very painful. And understanding consent. Yes is yes, no is no. And there are no other ways around it. This is not a conversational piece where we're going to try and dissect what kind of yes is the yes, what kind of no it's the no.
It's simple.
Yes. To women and to men and to everyone out there. I think it's important to respect someone's consent and someone giving you consent. And
consent can be withdrawn.
Yes.
Consent can be withdrawn.
At
any moment. You may be comfortable at one point and you're not. And it is okay. It is okay to feel like you are not comfortable anymore, and it is okay to retract that permission.
Yes.
Consent.
It is. Yes, it is.
It's as simple as that.
It's as simple as that.
There's no small yes. There's no big yes. There's no small no. There's no big no. A no is a no, period.
I think that's
I feel like that's like a
we've said actually, and that's with it.
No is that no.
That's the educative part of this podcast.
I said what I said.
And it's also important for people to understand pleasure, especially as you're going into your sexual journey. I know sometimes a lot of conversations are not had around the pleasure part of sex. Sex is supposed to feel good. Women, when you're not feeling lubricated enough, mwambie huyo mtu lazima afanye iwe lubricated, because that's what causes things like yeast infections. Too much friction, you end up with UTIs as well because you're not getting lubricated enough. It's important to understand that pleasure is an important part, and not only for one partner, but for both partners. And it also ties into your sexual wellness. So yeah, when we said understand your bodies, we meant it. Really understand your bodies, get to know your body, and communicate.
Yeah.
I think that's...
Again, just finally, a take home is know your status. There's no stigma around it.
Yeah.
Oh, yeah.
It's very accessible nowadays, be it online from the comfort of your home, buy MYDAWA, or walk into your nearest pharmacy, or go to your hospitals. Just know your status. Be it HIV, be it sexually transmitted diseases. It's important, and it's a part of sexual wellness.
Yeah.
Yes.
Cool. Thank you
have a challenge.
so much.
You've been fantastic.
Thank you so much,
You've been a fantastic guest host.
I
Wow.
know.
Yeah,
And I feel
really
like
well
there
done.
was so much we wanted to cover, but just
Yeah.
time told us.
Cheers.
Yeah, I think we'll do this again.
Yeah.
I think we need to
Another
have this
one,
conversation
another part two.
again,
Yeah.
and figuring out what we want to like delve into a bit more. Also, guys can tell us in
In the comments. I agree.
Yeah.
Yeah. And we have a challenge for you, our sweet guest.
Yes,
It was for all of us,
Okay,
darling.
fine.
Who is the all?
You,
Aish.
me,
what
and
was the challenge?
Dubri.
Actually,
I
the
forgot.
Powerpuff Girls. So, okay, what was the challenge now?
The
I'm just
challenge
like
was
Blossom.
Speak in your mother tongue
Aye.
and say what skincare
Yeah.
does.
Yeah.
But I'm choosing Kiswahili.
No, it's not your mother tongue, Dushi.
You know what?
Yeah, just
It
keep
is.
quiet.
It
So,
partially is.
We had a challenge. The last guest had a challenge for the next guest, which apparently is all of us.
It's all of us.
They said that we should say in our mother tongue what we use for our skincare. So,
Yes, like our routine.
Samira,
There's
carry
no way
me.
I'm starting, you guys.
Samira, take it away.
As our guest host.
As our
First of
guest
all,
host.
Guest
my
slash
mother
host.
tongue is
Yeah.
Swahili.
You
Get
know
out.
what? You know what?
Na kama Swahili, sindio? Natoka.
This
mimi
babe
ni
is
mtoto wa
lying.
bara. No, that's Nairobi people.
Yes,
Babe.
Bara is Nairobi.
Ati mimi ni mtoto wa
So
bara.
clearly you've
Bara is
cancelled yourself
Nairobi.
from that
Yeah.
one.
Get out.
Wanapwani. What the fuck do they call
Just
themselves?
exactly. Just get out.
Anyway, I'm coming from Tanzania even.
Actually,
Tanzania people, take me now.
cross the border.
Dr.
Cool.
Samira will carry this one and start and begin. Tell us your mother tongue and what you use on your face.
Suddenly, I use a 3-in-1. 3-in-1 shower gel. So my statement will be 1. Sawa Steve.
Suddenly.
Tumeagree, tumekubaliana. Aya, cool.
Even me, I just say one product.
So, okay, so what's the statement? I use a moisturizer, a face wash, and... Oh no,
A
I
face
use
wash,
a face wash,
moisturizer, and then sunscreen.
But I don't know what those are in Somali.
Same, but you
Yeah.
can cook. You can say
Okay,
like sun.
let's do this. Guys, shut your ears.
Close
Right
them.
now.
I'm going to send this to my mom. I
Even
wish I
me,
could
I'm
record
stressed.
this. Oh my
It's okay, we'll
goodness.
get the
Oh gosh.
snippet.
So,
If you look around more, you'll find it. Don't worry. Just look around.
okay. Oh, I want to say I'm speaking. Oh, Mahanko Halaya of Somali. And, and Guy, I'm having a brain fart.
It's okay.
Please
Yeah, I
just
can see it.
Cut out all the brain farts. Mahan isticmala moisturizer. Mahan isticmala face wash, moisturizer, and sunscreen. Wijige sun. Hava. And Mahan bilawe my face journey, skincare journey. In 20. When did I start my skincare journey? In 2018.
You're just speaking English here.
Mahan bilawe my skincare journey in 2018, and Mahan istemala face wash, moisturizer, and sunscreen. And recently, Mahan istemala La Roche Posay for the routine.
Yay! It's such a
Actually,
nice
well
language.
done. Well done.
It's such a nice language.
Beautiful.
If you give me another chance, I'll go and remember the
You
words.
butchered it,
Don't worry.
sorry.
Don't worry. We're not
Wrong
giving you
time.
another one, but don't worry.
No, it's fine, but don't forget them.
Mama is the
that
most
was a nice
important
one.
part.
Yeah, that was.
Guy. I've started even.
Actually, you
Guy.
started. Siri, you're there.
Nie de Mogikoyo na kwa othio wakwa dumiraga thafuni.
Wait, I understood that one.
Maguta. Na maguta ma riowa go shield kuma riowa nenyedete othio wakwa.
Actually, I'm so impressed.
Do you understand her? You understand
Yes.
her?
Because she's protecting me from the sun. I was like, sweetie, you remember the word sun in Kikuyu?
Yeah, you're what?
Habari
I'm
zenyu,
so happy.
habibis and habwanas.
Wewe.
Huku tunaongea Kiswahili, wasikia?
Habibis and habwanas.
Habibis and habwanas. Huku tunaongea Swahili kwa sababu walisema mother tongue na Swahili. I say, wanisikia. So, mimi kwangu naitwa Dushi Kuria. Usoni natumia sabuni ya kuosha.
Vyombo.
Kuna maseramu, otherwise known as serums, mingi sana mi hutumia sana. Ona uso, ni maserums mingi sana. Alafu mwishowe tunatumia sunscreen. Asanteni sana.
Sunscreen
Na
nini?
Sunscreen ndio hiyo kitu ya ku...
Kofia ya...
Ya,
Kofia ya ngozi.
Wow.
Sunscreen ya kinga uso kutoka sawa. Jua ikiwa moto sana, lakini pia hata kama hakuna jua, saa zingine wanasema kuna mambo yaitwa UV rays. Yaja chini yajaribu kuniingia, ya mimi nasema la hasha. La hasha. Humu ndani huingi.
Unasema, I hate you.
You're passing my interview. I hate you. Basi turudi kwa interview. Kwa hayo machache nasema asante kwa kunisikiza.
Thank you so much, my co-host.
Oh yes.
Your question.
Oh,
yes.
What? For the next
For the
guest.
next-
Yeah, what should we make the next guest do? Even though she's listening
She's
to
right
us.
here in the room
Yeah,
with us.
can we kick her out?
We're gonna tell her to get out of here, man.
Right
Get
now,
her
What should we
dead
give
end.
her as a challenge? Oh, you know what she could do? She could draw something for us. She could draw us the anatomy of where she thinks the stomach, the liver, the kidney. Remember
That's
that
a lot.
image we had yesterday when we were talking about what side we are feeling
She's a
pain?
doctor.
Actually, she's a
Oh,
doctor.
she's a doctor.
Yeah,
Where the
gizzards
gizzards are and
gallbladder.
where the gallbladder is. She could show us.
She's a doctor.
She's a
I think
doctor. That one
she's a
she'll
doctor.
get in
Yeah.
like 2 seconds.
Ama we should make.
That could be a challenge for her tomorrow.
Ama, you tell her to...
That could be one of our challenges for tomorrow. Akib, you'll remember, for our idiots, we tell them to do that for us.
Actually,
To
yeah.
draw for us the
Yeah, oh
organs.
God, our lovely,
That would
lovely family.
fail.
Our lovely
and
sweet
friends.
people.
I don't know.
To give us a shairi. Naambia leo mabibi na mabwana,
I did one.
karibuni
By
sana.
Shelly.
You remember?
I remember that one because
Oh
I've
my
never been.
gosh.
What will the shairi be about?
A shairi
Should be about
her field.
no.
What she likes to eat.
And with that, you can finish the
Wrap
episode.
it up.
Whoa.
So our next
Whoa.
guest, Ivo, remember, she's going to tell us
A shairi.
a shairi about sexual wellness. I don't know what that is in Swahili.
But she's
That's
gonna
her
figure it
business.
out.
That's her business.
That's her bid.
That's a business.
And we conclude. I have been your lovely guest, aka speaker, aka host.
AKA Daktari, AKA Oh.
AKA.
And it's time I retire this chair because I want to be next to Spinny so bad.
Our social.
But yeah, thank you for watching. And if you have any further inputs, comments, discussions, fun stories that you have about your sexual wellness story, please drop in the comment section below. Remember to like that bell that does ding,
Ding, ding, ding, ding.
and follow us and like and subscribe and follow us on across all our social media platforms, especially YouTube, because we are coming with a long list of all the podcasts that we are going to give you with our fun discussions and my hilarious co-hosts, by the way. They're really
The Aki thanks.
they're really pulling
Thank you.
episodes.
Thank you.
Coffee
But
I am
yeah,
gossip.
thank you so much for tuning in and see you next time.
Bye guys.
And it's a wrap.